夠人數亦都係夠時間咁。
Our members who have attained the quorum, is about time to make a start. The minutes of the meeting held on the 16th of October has been made available to members who have received no proposed amendments. Unless there are proposed amendments, can I take the minutes as confirmed? Item number 2, a couple of papers issued since the last meeting. Referral from the Public Complaints Office of the Legislative Secretariat regarding the complaint handling mechanism of the Hospital Authority. The second one is regarding the general outpatient clinics of the Hospital Authority. And the third one is inclusion of Glivec in the Hospital Authority drug formulary as a special drug, and the assistance provided by Samaritan Fund. And the last one is a referral regarding the location of methadone clinics. Unless members have any questions, shall we move on to the next item? Items for discussion. Shall we invite the administration in, please? The items for discussion and the list of outstanding items have been made available to members. The next meeting will be held on the 17th of December, a Monday at 4:30. The items proposed by the administration are: number 1, review of fees and charges for private patients and non-eligible persons in the Hospital Authority. There's item 3, and also strategy and measures in prevention and control of seasonal flu. There's item 4 in the list of outstanding items. Any comments on those two items? Mr. Joseph Lee. I've got a letter. Yes, this will be dealt with in just a moment. Okay, then for those two items, review of fees and charges for private patients and non-eligible persons in the Hospital Authority and the seasonal flu. Any comments? Okay, then we have those two items on the agenda, subject to further views. Welcome, Professor Chan, for the first time here in your capacity. I think we know everyone. We can do without the introductory niceties. We were talking about the items for discussion, the items proposed by the administration. We don't have any trouble. And Dr. Joseph Lee and Dr. Fernando Zhang wrote to the panel with the suggestion of discussing the monitoring of private hospitals. The Director of Audit submitted the report a couple of days ago relating to the land use operation of the private hospitals, with some criticisms there. We heard that the Public Accounts Committee will be taking up the matters. As per usual practice, according to the Secretariat, the panel would normally avoid having any discussion at the same time as the PAC. In accordance with the rules of procedure, the PAC will have to submit a report within 3 months after the hearings. So we members consider two options. Option 1 is to wait until after the PAC is done with the matters. Option number 2 if members would like to follow up on this matter as a matter of urgency, then the two committees should avoid dealing with the same area of business concurrently. Dr. Fernando Cheung or Dr. Joseph Lee first. Chairman, I wrote in to suggest a special committee, a panel meeting, not in relation to the PAC issues. They were looking at the land use, but rather I would like to have a look at the Department of Health or the Food and Health Bureau to see whether they have monitored the private hospitals well enough in relation to the use of resources, hospital beds and fees and charges. All of these have to do with the services provided by the private hospitals. Now, we will be discussing whether the DH has done a good enough job. I think the focus of attention would be a little bit different from the PAC. So that's why I wrote in to suggest an item for discussion. Now, we have to monitor the administration, and we are basically focusing our attention on whether the administration is monitoring the private hospitals well enough to make sure that they provide reasonable level of services. And this is something that I'd like to suggest for discussion. Dr. Kwokaki? Yes, this is important, Mr. Chairman. Other than what Dr. Joseph Lee said regarding the monitoring by the Department of Health, now there are two plots of land. The government has closed the tendering process. I'm not sure when the government will be announcing the results, because there would be grave implications on the development of private hospitals. The new administration has not indicated its intention. I think this tendering process was the business of the previous administration. Of course, I agree that there is no need for us to duplicate our work with the PAC, but as a panel, we do have the unshakable responsibility in this regard. If we're not doing our job well enough, then we're not really putting in the efforts in the eyes of the general public. So I suggest that we have some discussions there. Dr. Fernando Cheung, I go along with Mr. Joseph Lee and Ms. Dr. Kwokaki. The Health Services Panel is here to monitor the policies on health services on the part of the administration, and also is monitoring of the private hospitals. In terms of healthcare or health services policy, I don't think the PAC will be focusing its attention on. Now we're talking about the market or the provision of healthcare services by the private market, and there are two plots of land for which the tender exercises have been closed, as alluded to by Dr. Kwokaki. The way the private hospitals are managed and the way the administration is monitoring, what implications would there be if more private hospitals are going to be coming on stream? It is the right way to go to further privatizing the healthcare services in Hong Kong. Perhaps we can liaise with the PAC and see what slant they will adopt in relation to the Director of Audit's report. And three of us would like to focus our attention on the healthcare or health services policy, and also the monitoring by the government of the private hospitals. These are the slants that we'd like to approach the issues. Any further views? All right, I think members would like to schedule a special meeting. I gather it is a special meeting that is being proposed. And we will liaise with the PAC. Our focus of attention will be on the policy on health services and monitoring of the DH. Any further views? All right, let's let the Secretariat, or I will be liaising with the PAC myself, and see how we can divide up the work. Administration, I've got to include you in the loop. Chairman, we fully respect the panel's decision. Our view is that the Director of Audit's reports and also they have a particular angle. Perhaps you might wish to liaise with the PAC and give us clear instruction that would facilitate our preparation for the meetings. If a special meeting has to be held, then the Secretariat will have to look at the timetable, and I gather that by the end of this month, the PAC is going to be discussing this item. Okay, let's move on to the next item. Enhancements to the Elderly Healthcare Voucher Pilot Scheme. The administration's paper and the background brief have been made available to members. Just a reminder that under Rules of Procedure 83A, Declaration of Interests, members are not supposed to have any direct or indirect pecuniary interest and move a motion or amendments to a particular issue or speak on the subject unless they are prepared to disclose the nature of the interests. I'd like to remind members, if there are direct or indirect pecuniary interests, it would be a good idea for members to disclose the nature of those. Right, I'd like to invite the Secretary to take us through the paper, please. Chairman, thank you. The paper presented to members today is a proposal to enhance the Elderly Healthcare Voucher Pilot Scheme. We'd like to solicit members' views. This was launched in January 2009. It has been 4 years now. As of last month, October, 460,000 eligible elderly people did use the voucher scheme. About 64% of the eligible population. There are 3,500 healthcare services providers that have registered with the scheme. From the first phase of the pilot scheme, in fact, the Department of Health has registered 2.3 million transactions with an expenditure of $320 million.
Over the years, the pilot scheme has been well received by elderly people and private healthcare services providers. That's why we would like to, and there have been calls to increase the voucher amount. The Chief Executive also undertook in his election manifesto to raise the voucher amount to $1,000 per year. On the 16th of July this year, it was announced by the administration that we will increase the voucher amount starting from the 1st of January to 2013. And the amount will be raised from $500 per year to $1,000 per year. This will widen the affordable healthcare services choices for the elderly people, and it can also encourage the private health care service providers to join the scheme. And we propose to convert this pilot scheme to a recurrent support program. Subject to approval, the accumulated unspent voucher amount can amount to $3,000 maximum. That means an eligible elderly person can accumulate up to $3,000 as at the 1st of January each year, so that we can encourage the elderly people to engage in preventive care. Now we propose that the scheme can be to be converted to a recurrent one, and in that case, we will be needing $360 million next year. By 2015 to 15, the expenditure will be included in the recurrent estimates. We propose in December to seek funding approval from FC, subject to members' approval, and we welcome you to express your views on these proposals. All right, question time for members. Usually on this panel, we tend to ask more and more questions. Now we have 5 members waiting to ask questions and 3 minutes for each Q&A session. But now I suppose there will be more and more people raising their hands. So please be succinct so that the administration can answer your questions. I'm sure you can do that. Let me read out the names. Mr. Wong, Kwok Heng, Kwok Ka-Kay, Joseph Lee, Chen Hang Ben, Fernando Cha, and Alice Mack. Mr. Wong, Kwok Heng. Chairman, I welcome the administration's proposal to convert the scheme to a recurrent one. I would also like to commend them in raising the voucher amounts. They do not ask the scheme to be a means-tested one. I would like to criticize the old age living allowance scheme. Thus, I'm going to give you commendation and criticize Mr. Matthew Cheung in his practice. But I would like to raise several points. Now, how come you set the accumulated amount to $3,000 maximum? The elderly people do not want to get ill, so can you remove this restriction? If the money can be well spent, you should not set any restrictions, and this practice will not accumulate more pressure on your side. I would like you to lower the eligible age to 65 instead of 70, because at present, people have live a long life in Hong Kong, which is good. But exactly because of that, they have to go to see the doctor more often. Only when you are 70 can you get the voucher. So can you lower the age to 60? I think this will be best. So 2 questions for you. In fact, the 3,000 unspent amount to be accumulated maximum, it has been scrutinized carefully by us. Now, there is this maximum because we want to encourage the elderly people to spend the money. Otherwise, they will simply accumulate the amount instead of spending it. That's why we're encouraging to spend the money. Once the scheme has been converted to a recurrent one, the means test, with this maximum amount to be accumulated, it will be better on the financial side for the government. Now, for the eligible age, in fact, we have already assessed the effectiveness of the whole scheme, and in the long run, the financial commitment has to be under scrutiny as well, but we are open-minded. when the scheme is converted to a recurrent one, we do not have any plan to make any changes to the eligible age. Now, you have a lot of reserves, so I think you really should consider lowering the eligible age. Lowering it to 65, we're talking about over $952 million per year. So I think you can actually live with the financial implication. Mr. Kwok Ka-kai, Mr. Wong Kwok Heng criticized heavily the OH allowance proposed by the government. So may I urge him and his party, DAB, to join hands with us to oppose to the means-tested OH allowance proposal. Now, coming back to this elderly healthcare voucher scheme, I also agree with the administration, but I would like to follow up on Mr. Wong Kwok Heng's question. That is to lower the age to 65. Why this age? Because for most elderly people, they do need health care services because they may be chronically ill. So if you do not lower the age to 65, you cannot help those within the range of 65 and 70. And for those chronically ill, they have to spend a lot more. So for specialty, for outpatient services, if an elderly person has registered for these services, they should be entitled to a higher amount. I'm sure you also know that for this group of people, the expenditure on healthcare services is higher, no matter whether we're talking about physiotherapy or Western medicine. That's why I think you should give them more. You're giving them $1,000 per year now, and for chronically ill, $1,500. If they are chronically ill and over 65, you should allow them to join the scheme. Our aim is to help these people and not just to look at the financial side. Thank you for the questions. Now, for elderly people's needs, we do appreciate what they need. And for the age issue, we are open-minded. We have completed the first round of interim assessment, and we will closely monitor how the scheme is operating. Once it's been converted to a recurrent scheme, we will continue with the review. So we take on board your suggestion of the age issue of 65. May I defer to my colleague to tell you more about the assessment? Dr. Lang? Now, to lower the age to 65, maybe even 60, is a call from the community. Ever since we rolled out the pilot scheme for the first time, we have already recorded this suggestion. Now, about the statistics, do your statistics support this suggestion to open up the scheme for those over 60? And those chronically ill? We do not have such statistics. Can you supply these statistics to us after the meeting? Yes. Next, Dr. Joseph Lee. Thank you, Chairman. Now, of course, we support the scheme because we're talking about giving more money to the elderly people. But then in your paper, you wrote of the scheme in 2008, and you had the aim to encourage those over 70 to seek healthcare services in the private sector. But then in money terms, you still have $300 million left because you have got $1.5 billion altogether. Now, the money is not there so that the elderly people can consult doctors. You have a lot of services over the past 3 years. How is the money used? Are the vouchers just for them to see the doctors, or have they gone to the Chinese medicine practitioners, or for them to check their eyesight? And how come the usage rate is so low? Is it because it's very complicated or what? Next question. Of course, if we are talking about $3,000, it will be good, but then even when you give them $250 per year, there is still a lot left in the voucher. So how much money have they not spent? Of course, raising the amount would be good, but what do you propose so that the elderly people will actually spend the money and the money will not go back to the sector? Because the vouchers are there, so elderly people will go to the private healthcare sectors to seek services. So you still have so much money left unused. What are you going to do? Let me first give you a broad answer, and Dr. Leung can give you the statistics. All along, we check how the vouchers are being used. A major part is for consultation with with medical doctors and Chinese medicine practitioners as well. Now, about the low usage rate or take-up rate. In fact, we're talking about over 60% of the elderly people or the eligible elders who are using the vouchers. Maybe you would like to see a higher rate. Now, the Department of Health is already working on promoting the scheme with the elderly people. As for whether it's complicated, in fact, the elderly people do not have to register or pre-register or to use the computer. As long as they see there is a trademark they can visit that doctor. It's just that the service providers have to go through the registration and go through the computer processes. So for the elderly people, things are not really complicated. For the statistics, I'll defer to Dr. Leung. Thank you, Chairman. Now, looking at the statistics, reason for consultation, nearly 70% of the vouchers are for acute illnesses, and about 7% for preventive care, and 22% for follow-up treatment or monitoring on chronic diseases. Now, out of different kinds of healthcare services providers, 78% on medicine practitioners and 10% Chinese medicine practitioners and 10% dentists. As for problems with eyesight or treatment for eye conditions, we only covered optometrists in 2012, so we do not see a high take-up rate in this regard. She hasn't answered my question. What do you propose to raise the take-up rate? Well, I think you give them more money. But even with the raised amount, not a lot of people are using it. Let me supplement here. I think Dr. Lee is concerned about the low take-up rate. Now, over 60% of the eligible elderly people have registered, but we're talking about just 60% of them actually using the scheme. It all boils down to the fact that the scheme was a pilot one only. So people may not think it's a long-term scheme, and the service providers were not really interested in joining the scheme. Now we are proposing to raise the voucher amount to $1,000, and we're proposing to convert it into a recurrent scheme. So with these factors, the service providers will know it's there to stay, and the service needs will be growing. So we expect the take-up rate will be higher. The Department of Health will step up on promotion, especially with giving more assistance to Chinese medicine practitioners. so that they join the scheme. We will also promote it with the elderly people, so I expect the take-up rate will be higher. Can you supply us with the statistics in written form? Yes.
Mr. Chen Hanpan, right? The increase in the rate and also the accumulation up to $3,000. I welcome this. Some suggested that the age eligibility be lowered to 65, and if this is the case, how many more will stand to benefit? And also, how much more will have to be spent by the administration? And also in the e-health system, the senior citizens will have to register. Many senior citizens would like to patronize the traditional Chinese medicine practitioners. Not all of them, not many of them have registered. How can you assist the TCM practitioners to register, and what technical assistance will be given? Professor Chen, right, to answer the first question, if we lower the age to 65, the resources would be $1 billion. I mean, that was mentioned by Mr. Wong Kwok Heng. There's an additional, no, not additional, we have to spend a total of $1 billion. 300 million odd. Well, that's a big discrepancy. I would imagine that those above 70 would be more in number than below. Chairman, for 65, we're going to be increasing by 35%. It would be 1 billion. So each year it would be about 300 million. So the Secretary has got it the other way around. 70, it is 700 million. 65, it is an additional 300 million. That's altogether 1 billion. All right, Dr. Leung. Since the e-health system has been launched, we have enhanced the system considerably. About a year or so ago, we adopted the smart ID card reader. Each service provider will be provided with this reader. So with an insertion of an ID card, they will get the information that would minimize all these errors, the number of consultations, the number of vouchers, and so on. This can be covered by the ID card reader. Very straightforward. Dr. Fernando Zhang. Chairman, thank you. For those above 70, the take-up rate is 60-odd%. I mean, this is still on the low side. This has been around for about 4 years now, or 3 odd years to be precise. Still, the take-up rate is only 60% for the 70 or above population. I get the feeling that they would probably spend a couple of $100 per year for consultations. So the idea of the scheme is to move the consultation from public sector to the private sector practitioners. But I can't see a lot of that happening. That they may be utilizing the services on both sides. Now this is costing us more than $1 billion, and you have given us so little information. It's only when pressed that you said 70% would be for acute, 20% for follow-up. Now you're moving them from the public sector practitioners. I think that a lot of them are chronically ill patients, and they're only taking up 20% of the services. Many 70% should be episodic, those migraine and dizzy spells and so on. Now, are the users CSA, say, recipients, or what capacity, what status are they, and what about the regional distribution? You haven't given us the information. Are they chronically ill senior citizens or not? If you don't have the information, it would be hard for us to ascertain whether you have achieved what you've set out to do in this voucher scheme. Of course, we welcome additional resources for the senior citizens, but I don't think we can do it without any purpose. We have a paucity of information that do. Please give us more statistics. Secretary? Chairman, the idea is to improve the cooperation between the public and the private sector. We also like to ease the pressure on the general outpatient clinics. The government also has the intention of promoting primary health care. If we can encourage the senior citizens to utilize not just the general outpatient clinics, but also the private sector, then it would certainly be good for the health of the senior citizens, and they would be encouraged to use primary health care more. Dr. Zhang said that the information is not sufficient. We're happy to furnish him with the information after the meeting. Now, this is a pilot. Many a time, the service providers or the senior citizens might get the feeling that this is only on a pilot basis and they may not be tempted to use it. So we're going to make it a regular service. And the Department of Health will be mounting publicity campaigns to boost the utilization. Dr. Zhang, can the review report be made available to us? Would that be okay? The interim review started at the end of 2010 and in 2011 has been posted on the web. Ms. Alice Mack, Chairman. That the senior citizens are not using the unspent vouchers. Previously, it was $500. Now, the accumulation can be up to $750. Now, the accumulation amount is $3,000, but they don't really want to spend the vouchers. They may be allowed to use chiropractors. I mean, for general practitioners, it would cost them more than $200. Chiropractor treatment, it is $500 per consultation. Physiotherapy, a couple of $100. They would like to build up the vouchers. They don't really want to use them. I don't think the accumulated amount should be $3,000. I mean, if they don't have any idea how much they have accumulated up to, at the beginning of this year, the Secretary has made available a paper to LegCo. Even if we lower the age from 70 to 65, we're talking about an additional 300 million, but you can benefit 300,000 more. Why is it that you're not prepared to consider lowering the age threshold to 65 to benefit more? And in that particular paper, you haven't included those who use an entire year's worth of vouchers. In your statistics, I think you should include some statistics on those senior citizens who are using up all the vouchers all in one go. Now, we would like to find out about the effectiveness of the voucher scheme. Dr. Leung might wish to supplement. I was referring to the paper made available to us by the Secretariat. Yes, thank you very much. For those 65 who should be eligible, we've heard a lot of suggestions in this regard. We'll consider that. Ms. Mack referred to the ceiling of $3,000 and the way in which the senior citizens use the vouchers. Perhaps Dr. Leung can fill the members in on the details. According to our statistics, each time the senior citizens go to the doctor, Normally they would use 2 or 3 vouchers, $100 to $150 or thereabout. We don't restrict them in terms of numbers. They can use all the vouchers they have on hand. As of October this year, about 20% of the senior citizens have used up all the vouchers in their accounts. All right, Mr. Poon Siu Ping. Chairman, thank you. I support this scheme myself. It would be a good idea to turn this into a regular scheme. Now, it is $1,000. I think you're doing it in accordance with the manifesto of the Chief Executive, and this is going to be on a regular basis. What objective criteria are you going to have for adjustment in future? And para 18, there are 10 non-civil service contract staff. If this is made regular, presumably the staff should be converted into permanent staff. Will this be done? Secretary, thank you very much, Mr. Poon, for the question. The manpower, I can defer to Dr. Leung. Now, the $1,000, it is true that the Chief Executive's manifesto mentioned this amount. Now, we must bear in mind that it has increased from $250 to $500 last year. We had an interim report, and we heard what the members of the public had to say, and that's why we increased the amount. We've also heard that $500 may not be sufficient, and also the manifesto of the Chief Executive mentioned this. We've decided to increase this to $1,000. But as we go along, we will monitor the situation, the needs, and so on, and how the vouchers will be used, whether the senior citizens will be using them up on one go. We'll monitor the situation as we go along. Dr. Leung, the manpower, right, the 10 contract staff, by the time this is regular, we apply for them to be converted into civil service staff. Ms. Elizabeth Quat. Chairman, I welcome this increase to $1,000. Right now, 35 million service providers are part of the pilot scheme, or 3,500 rather, are part of the scheme, and there's what percentage of this in terms of the overall figure? How many of them are traditional Chinese medical practitioners? I've heard from the TCM's practitioners that they don't have any computers, and they don't know how to grapple with the system, and they rather not join the scheme. So how can you encourage more TCM practitioners to join, and what difficulties do they encounter? What assistance will be given to them? Many senior citizens would like to patronize the TCM practitioners, and they want to stick with their own practitioners. Now, how can you resolve their problems? Now, for the expensive ones, they probably wouldn't go to them because they're too expensive, and they cannot be helped by the vouchers. All right, Secretary. TCM practitioners. Mr. Chen also alluded to this point. When the DH promotes this scheme, we will pay particular attention to the computer needs for computer assistance for the TCM practitioners. There seems to be such a demand. As regards the 3,500 service providers, now we are talking about all the service providers. Now perhaps Dr. Leung can elaborate on this. Dr. Leung? We have 1,500 or so medical practitioners who have registered. That's about 31%. Now, all the registered practitioners, we've taken out the public doctors and also the retired ones. Now that would give us a figure which has underestimated the situation. Let's say there is a pediatric, and this is also included. Some service providers are not part of the scheme. We ask them why they wouldn't like to be. That's because they're not serving the senior citizens as a major source of their customers. Right, we're basically looking at the family physicians. They're on the front line. The number is not particularly low if you talk about the family physicians.
So how can you rally more TCM practitioners? We're talking about 18.5% of the TCM practitioners joining the scheme. Next, Mr. Chen Ho-Chu. Now, usually when pilot scheme is made a recurrent one, there must be a reason for the government to do that, but I do not see one in this case. So they're simply proposing raising the amount to $1,000. Looking at the take-up rate, are we talking about a high take-up rate if it's 2/3? I don't think so. There must be some reasons why these people are not making use of the vouchers. I do not know why. You may say that the review report is now online, but I don't recall reading it. Well, the poorest 1/3 cannot make use of this scheme. But the most important thing is, how come they do not make use of it? Next, you allow them to accumulate the amount. Now, the allowed amount is over $2,500. You raise it to $3,000. Have you asked those people how come they accumulate the amount instead of using it? Is it because they have to take transport to go to a certain district in order to see a doctor? I don't know why. No, I don't think you have a comprehensive review. And you're proposing to spend $1 billion to make it a recurrent scheme. I mean, $700 million. You're trying to provide them with primary care. But the best thing is for you to provide them with body checks. But I don't think it's included. So can your review report tell us whether it will not be, tell us if it's not a recurrent scheme, is it a bad idea? Now, of course, we welcome your proposal to raise the amount and to make it a recurrent scheme. But there's one thing I have to ask you. Is it the right way for you to go to provide primary care? We do not have most of the basic statistics, so we can only ask you for the basic statistics. I think we should have a comprehensive discussion for this scheme. For the provision of basic care, primary care, well, I welcome your suggestion. In fact, we cover lots of areas under primary care, and this scheme is just one of the areas. In the interim review, we are of the view that we understand from the interviewed elderly people that they welcome this scheme. Over 60% of them are making use of the scheme. And meanwhile, the Department of Health is also promoting the scheme. We have to raise the take-up rate. We would also like to invite more service providers to join. For example, some query why we have such a small amount of TCM practitioners joining the scheme. So we have to do a lot more on this front. If the service providers are nearer to the elderly people, of course they will make more use of the scheme. So we will step up our effort in this. As to why they do not use the vouchers, well, we mentioned that in the interim report. Maybe Dr. Leung can supplement here. Now, in the interim review, we also asked those elderly people who do not use the vouchers. They gave 4 reasons. 1, they have got a familiar practitioner, so they do not join the scheme. Next reason, they use the services in the public sector. Next, another reason is they do not need to go see a doctor. And the last reason is that the service providers are not near their home. Now, just one short question. Just tell them the vouchers can be used for body checks. If that's the case, of course they will use that, because they have to queue up for a long time in the public hospitals for that. No, you have to understand the review was done a year after the scheme, and at that time we're talking about an amount of $250 per year only, and after the report we enhanced the scheme considerably. The Democratic Party, of course, welcome the administration's proposed enhancements of the scheme, but we would like you to consider lowering the eligible age to 65, and we would also like to see the amount to be raised to $1,500, because you visit a doctor once, it will cost you hundreds of dollars. So you tend to use up the vouchers very quickly. The ultimate aim is to encourage the elderly people to go to the private sector for healthcare services near their homes instead of going to the public sector. So if they treat their illnesses at an early stage, they do not have to go to the public sector and to incur so much cost. So that's why we ask you to lower the eligible age to 65 and to raise the amount to over $1,000. Another big concern is how come the elderly people are not using the vouchers. I also asked them when I accompanied them to see a doctor, how come they're not using the vouchers. For example, in Yomata, where you have a large elderly population. But then the answer is that they haven't joined the scheme. So I think the focus of the enhancement, it should be on the family clinics unless they provide good reasons. Otherwise, they should accept the vouchers. So what can the administration do to promote the scheme so that all these clinics, whether we're talking about Chinese traditional medicine practitioners or medical practitioners, so that they would not simply say no to the scheme? Only in that case, the elderly people do not have to take transport and to search for the practitioners in your scheme. People are not using the vouchers because some clinics are not joining your scheme. So I think you should promote the scheme with all these clinics, all these family clinics, so that they should be joining the scheme unless they provide very sound reason. So how can you broaden the coverage of the scheme? What do you propose to broaden the coverage of the scheme so that the elderly people can find it easier to use the vouchers? Thank you for the question. You know, your last question is how the more service providers will be joining the scheme. Apart from the fact that the DH has to do more, converting the scheme to a regular one, I'm sure will remove their doubt as to whether the scheme will stay. So as long as we can convert it to a regular one, I'm sure things will be better. Now, for lowering the age to 65, yes, we take on board your suggestion. We'll look at it after the meeting. As for raising the amount to $1,500, we will closely monitor how the vouchers are being used and whether there is a genuine need, and we'll also look at the charges too. Thank you. Second round, Mr. Fernando Chang. Thank you, Chairman. Now, in the interim report, it's mentioned that you do not want to change the eligible age of 70 because you are not sure about the effectiveness of the voucher scheme in changing the elderly people's habit. But I don't see how you propose, but I don't see any evidence that shows your aim of pushing the elderly people to the private sector instead of the public sector. Still, you refuse to change the eligible age. I don't know why. Giving more resources to the elderly people, of course, is a good idea. Now, apart from the fact that it's something mentioned in the manifesto, what's the reason? It seems to me that you only look at what the administration would like to do, and now you have to come to us and you say that you're doing this because the CE has mentioned it. Now we ask you to change the eligible age, but you do not take it on board. Is it because the manifesto has not mentioned it? I don't think it's a rational way to go about it. The pilot scheme has been around for 3 years, and there's no evidence showing that you have achieved your aims. But you're proposing all these because it's been mentioned in the manifesto. So after it's been converted to a regular scheme, when will you consider lowering the eligible age to 65? Thank you, Mr. Cheng. Now, I've heard your opinions and other members' opinions on lowering the age to 65. I hereby undertake that we will really look into this matter. As for the effectiveness of the scheme, now for this interim report is there to review the early stage of this scheme. After the scheme was launched for 1.5 years and the amount was set at $250. Now, after the report, the DH has done some enhancement. It's just that we haven't got the next report to show you the effectiveness. So I don't think the interim report can give you a full picture. We already have plans. Once this is plans to review the usage, once this has been turned into a regular scheme. Now, they have completed the interim report, but now they're saying it's outdated. And now they're proposing to turn it into a regular scheme, which is based on an outdated interim report. When we challenge them on this, they're telling us the report is outdated. What sort of logic is that? I think you have got the answer for yourself. Next, Mr. Albert Ho. A very simple question. I've listened attentively to the questions and comments made by my colleagues and the answers given by the administration. The administration says that you will take on board the views expressed. This is a very typical answer from the civil service. But please remember, Secretary, you are an accountable officer. So you are not simply here to execute any decisions given to you by the administration. So do you agree to lower the eligible age to 65, and will you fight for it with the chief executive? Now, Mr. Ho, thank you for reminding me about the fact that I am an accountable official. Now, having said that, we're just humans. Having listened to the views expressed by so many members and some other members who have met with us, we I can tell you we endeavor to serve the public, and we will consider views expressed. Well, it's a good answer, telling us that you are human beings. Do you think we make a reasonable request then? We will look at the whole picture about the scheme and the demands from the public. Do you accept our views as a humane official? Do you agree that it's reasonable to lower the eligible age to 65? It's just a simple question. Now, for questions raised by members and comments raised by you, I'm sure you are reflecting the public's views to us. You're not trying to make things difficult for the administration. So I will not say I disagree with you.
Well, I hope that you would have the same humanity as we all have. All right, last speaker, Ms. Alice Mack. Secretary, with this increase to $1,000, why don't you allow the patients to procure drugs with this? If you have a look at the GOPCs, a lot of the chronically ill patients would like to get the drugs with this amount of money. If you allow them to do so, then you shorten the queue for the GOPCs. Right, drug procurement? Yes, both the DH and the hospital authority do have the arrangement. We don't really want to have double subsidy in this regard, Ms. Mack. Well, it's not double subsidy, Secretary. They will not have to get drugs from the government, and they can procure the drugs from outside for those chronically ill patients. It's not double subsidy, isn't it, Dr. Leung? A lot of these drugs are prescription drugs, and they cannot buy over the counter, Ms. Mack. If they go to the private practitioners, and they are given the prescription, and they can buy the drugs with the prescriptions, but that they have to go to the doctor. Yes, they go to the GOPCs for the drugs. I appreciate what you said, that these are prescription drugs. I appreciate that. Well, they have to have medical supervision in terms of their conditions. But if they can buy the drugs with the money, it would be a good idea. Yes, we regularize the scheme first, and generally speaking, this is not for drug purchase. Now, sometimes they need to have drugs prescribed for them. We don't really encourage them to purchase drugs with the vouchers, but certainly this can be considered as we go along. Ms. Mack, I'm not so daft, Dr. Leung, that these drugs are bought over the counter. I have, please credit me with more intelligence, that I know that they have to be bought with prescription. I'm trying to minimize the financial burden on their part. I'm not so daft as to not understand that, Dr. Leung. All right, let me summarize. Most members would ask the administration to lower the age threshold to 65. More TCM practitioners should be brought into the scheme. And in terms of review, we should find out how many have moved from the public sector to the private sector for consultations. It seems to me that most of us are in agreement with this proposal. So unless you have an objection, we support this funding proposal by the administration. Let's move on to the next one. Construction of Tin Shui Wai Hospital. reminder again, under ROP 83A, if there are any pecuniary interests, direct or indirect, you're not supposed to move any motion, amendments, or speak on the subject unless you're prepared to disclose the interests. So please do so if you do have this kind of pecuniary interests. So we're going to have a change of personalities. Perhaps in the interest of time, Secretary, will you take us through the paper? Chairman Embers, this paper seeks member support for the proposed construction of the Tin Shui Wai Hospital. The anti-West cluster sees an increase in population coupled with the aging population. The services in the anti-West cluster will not be enough to meet the anticipated demands or increase in demand, and there is a need for us to build a hospital in the anti-West cluster to meet the demand. This is in area 32 of Tin Shui Wai, and we're going to build a new hospital there to provide hospital services, ambulatory, community care, and we're going to provide diagnostic and treatment facilities too, as well as support and administrative services. Upon completion, this hospital will not only provide acute hospitalization and ambulatory services to Tin Shui Wai residents. We will also have resources available to meet the demand, increasing demand in the anti-West cluster. At the present moment, the design has been completed, and the assessment of the tenders has also been completed. This is going to cost us $3.9 billion in money of the day prices. With members' consent, we'll seek a funding proposal in the first quarter of next year at the Finance Committee. With the funding approved, we'll get on with the construction. It is proposed that in the second quarter of 2016, the projects would be completed. I urge members to support the funding proposal for the construction of the Tin Shui Wai Hospital. There are 9 members on the list, or 10. Please make it efficient, 3 minutes each. Albert Ho, Leung Chi Chung, Kwok Ka Ki, Fernando Zhang, Helena Wong, Joseph Lee, and Chen Han Pan. Albert Ho, please. Chairman, I would like to see this done as soon as possible, as the population increases in Tin Shui Wai. The children's hospital is coming under increasing pressure, and it is causing problems to the residents in Tuen Mun. The Democratic Party, together with some Tin Shui Wai residents, would like to submit an open letter to the administration. Perhaps I pass it on to duty staff. This is our request. If you look at the plan, the Tin Shui Wai Hospital, the exit is on Tin Ying Road. This is not a Y road. This is connected to Tin Shui Road, which is served by the LRT. The residents are concerned that if there are traffic congestion on Tin Ying Road, it will be blocking the access of the emergency vehicles. So they are proposing that on Tin Ying Road, this is a 3-lane traffic, 3-lane carriageway. There should be an other ingress and egress on that particular side of the hospital. I'm wondering whether this can be addressed today. Secretary, Thank you very much, Mr. Ho. We'd like to get this completed as soon as possible. So that's why we would very much like to have member support for us to go to the Finance Committee soon enough. As to your question, I defer to Mr. Lee. Chairman, Tin Tan Street is where the major entrance is. We have conducted a TIA, the traffic assessment. The Tin Tan Street would be sufficient to cope with the demand. Even for emergency vehicles. During the consultation period, the district councillors mentioned an additional road on Tin Ying Road, but since the ingress and egress is located on Tin Tan Street, if we have to build a flyover going from Tin Ying Road, then we'll have to conduct the site survey, we'll have to conduct the design and assessment involving the contractors, and that would add another 4 years to the timetable. And the planning will have to be done all over again, and there will be implications on the completion date of the hospital. Since the TIA results are satisfactory, we'd like to adopt the original proposal. Mr. Ho, I don't think the district councillors have any faith in your assessment. We do have reservations about this. Mr. Leung Chi-Chung. Chairman, the Tin Shui Wai residents have been seeking the construction of the Tin Shui Wai Hospital for more than a decade. I count myself as lucky that I can be sitting here looking at this proposal at LegCo. Now, this is supported by everybody, although there are concerns. There are two schools, and it is quite close to the residential dwellings. The district council would like to see the misgivings on the part of the residents minimized. And I hope that you will explain more here in future. What Mr. Albert Ho said was raised by us before. Now, you said that according to your study, there is no need for additional ingress and egress. But I think that there may be problems caused to the access to the hospital. I think that you should also set aside land for expansion and also for traffic arrangement to be added in the future. That would be better for and remedial work in future. And also in terms of the facilities, I hope that depending on the population profile, there can be more obstetric services and mental services. And there is a greater demand for these in Tin Shui Wai in particular. Secretary, thanks very much, Mr. Leung. We did consult the district council. We have conducted an EIA and also an assessment of that particular area. I defer to Mr. Lee for further details. You mentioned the services, whether there would be adjustment going forward. Now we will, depending on different stages, develop the services having regard to the population and the demand and so on. Mr. Lee, Chairman, in terms of design, now this hospital will be located right at the heart of a community center, and the design will be done in a way that it will not cause any undesirable effects on the residents. This is going to be a design and build project. We will write it into the contract that the design will minimize the impact on the residents, like the mortuary. This should not be visible to the residents nearby. These will be written into the contract for the contractors to comply with. In terms of expansion, we are liaising with various bureaus to see whether there would be land set aside for expansion purposes in future.
OK， 下一位。
Next, Mr. Kwokake. Now, as members have said, the residents in Tin Shui Wai have been waiting for more than 10 years for the construction of this hospital. Apart from giving you my support, I have some questions for you. You state here that it is a general hospital. I'm a doctor myself. But then you only have the medicine and geriatric departments. What about obstetric and also pediatrics? It seems to me there are many disciplines that you haven't included here. Now, Pok Oi Hospital has been a painful experience for us. I understand that you have a shortage of manpower in Pok Oi. Coming back to Tin Shui Wai, it seems that you're repeating the whole thing again. This is not a general hospital because it is not one. I think you should be fair if you want to build a general hospital. My concern is for the elderly people because most of them suffer from orthopedic problems. I understand that you may not be able to include all the disciplines here, but at least take care of the elderly people. Now you have outreach services for mentally ill, but what about outpatient services for these people? I don't know whether you missed out this point in the paper or is being covered under the outreach services. You cannot expect these people to go a long distance to search for the services. As a doctor myself, I understand that maybe people have to go for obstetrics services. Now you told us the bed occupancy rate in New Territories West is the lowest in Hong Kong. So I think you need at least 500 beds in this area in order to cover the beds that is in shortfall. So how come you cannot cover this difference? Thank you for the question. We are here to serve the public as to whether it is a general hospital. I'm sure the hospital authority has undergone a lot of discussions in coming up with a plan. We look at the overall service demands in NT West and also the additional future services to be provided, as well as the manpower in Tuen Mun and Pok Oi hospitals in coming to this decision. Now, towards the commissioning of Tin Shui Wai Hospital, there is room for adjustment as to how the beds are to be used. We have rehabilitation beds and also beds for the acutely ill. And about half a year before the commissioning, we will look at the whole situation again. So we can definitely make the required adjustments as to whether we will be providing sufficient beds. Now, there are some beds to be added in the coming years in Tuen Mun and Pok Oi hospitals. So once those beds are added, the Tin Shui Wai Hospital will be in commission to provide services to the public. Now, I asked you questions particularly about pediatric services, obstetric services, and orthopedic services. Are you going to give me your undertaking or not? About 2 years before the commissioning of the hospital, we will see how we're going to divide the beds up for different services. What about the outpatient services? You will provide that. So even without beds, will the outpatient services be of help to the residents. We have specialist outpatient services that covers the obstetric and orthopedic services. Maybe Dr. Low can help us out here. Please be brief. Now, for the special outpatient services, is included. We will look at the demand, and if for certain specialist services there are still demands, then we will start providing such services. So you see, we are flexible here in responding to the needs of the community. Next, Mr. Fernando Chung. Thank you, Chairman. We will only see this hospital in Tin Shui Wai by 2016. You may remember we took to the street in 2007 to call for the building of this hospital. There were lots of domestic tragedies in the area. And we told you about all these problems there concerning the employment, etc. We took to the street, and they told us we had to wait for 10 years for this hospital. Now, this is the answer of a heartless administration. Now they undertake to build it, but then the services are not sufficient. We know that for ear, nose, and throat services, people have to wait for 96 weeks to get an appointment. This is completely inhumane, beyond one's imagination. Now you're telling us that things are flexible and you can make adjustment. That's a summary of your answer, actually. Now, for the bed ratio in NT West, what will be the rise in the rate? Across the territory, we're talking about a rate of 2.9 per 1,000 population. So by the time the hospital opens, what the ratio will be? It seems to me once the hospital opens, you are going to deploy medical staff from within the cluster to this new hospital. How can you ensure there will be sufficient manpower without affecting the manpower in other hospitals, and particularly the other hospitals in the same cluster? As for the health centers, there are 2 at present, and they can provide up to 200,000 appointments per year. So everyone is entitled to 1 appointment per year. So you see there is a shortage in supply. Do you intend to raise the provision, increase the provision of such services? Thank you for the question about manpower and giving us the information of waiting time for an appointment. Perhaps Dr. Low can answer the question. Thank you, Mr. Fernando Chung. Several things. Firstly, on the outpatient services. Now, we understand that in Tin Shui Wai there is a keen demand for this service. So several years ago, we already started the public and private sector cooperation. So over 1,000 patients have been moved from the public sector to the private sector. So we have room spared. And at the beginning of this year, the health center in Tin Yip Road was open, which provided outpatient services to grassroots. We will be adding over 20,000 appointments to the center. And we hope in the coming fiscal year there will be more resources for us to raise the services. We hope we can progress gradually up to the opening of Tin Shui Wai Hospital. Now, this year we have over 20,000 tickets for appointments. So what about the rise in bed numbers? According to our statistics in the cluster up to 2021, we will be needing 780 beds in the cluster, not just in Tin Shui Wai, but in Tuen Mun, Pok Oi, and the future Tin Shui Wai hospitals. So in terms of hardware, with the over 300 beds in Tin Shui Wai hospitals, we will be able to satisfy the demand. What about the rate? From 1.9 up to what? As stated in the paper, 3.1 per 1,000 population. That will be over the average rate of 2.9. Now, in opening new hospitals, it doesn't mean that we put the fresh graduates to the hospital to work. So we will be deploying more experienced staff to the new hospital to work alongside the fresh grads. So does it mean that we will not be adding more manpower to those hospitals where staff have been deployed? No. So it means you will not just move the officers overnight to the new one, right? Ms. Helena Wong. Yes, I also hope that the hospital will be built as soon as possible. I also hope it will be a genuinely general hospital. Now, can the 300-odd beds really be sufficient to handle the increase in population in Tin Shui Wai? I hope you can give us some scientific reason to support you. Now, in building this general hospital, will you take into consideration the rise in number of mainland babies born to mainland parents? You know, these babies will be born in Hong Kong, and local residents find it very inconvenient that they have to deal with it. So will you consider building a mother and child care center? You only have 3 across the territory, and for local residents, they have to go to Tuen Mun for one nearest. Even when you want to give vaccination to the babies, they have to wait for a long time. So can you consider adding relevant services in Tin Shui Wai hospitals to take care of the needs of newborn babies and pregnant women? Now, a follow-up question on point raised by Mr. Albert Ho about the traffic issue. 10 district councillors from Tuen Mun and Yuen Long show their concern. Now, just now, you said you picked Tin Tan Street as the main entrance, but 10 district councillors have visited the site, and they have their concern because Tin Tan Street will be the only way for people to go in and out of the hospital. Now, this road is where the LRT rails are. So just in case there is an accident involving LRT, will the access be blocked, which will in turn delay medical treatment to your patients? Now, you are telling us maybe there will be a delay in timetable if you have to look into this traffic issue. But since we have already foreseen these are possible problems, I think we better deal with it as soon as possible before things are too late. Now, residents would like to raise some comments about the design and the fronting of the hospitals. They don't want the main entrance to be facing residential blocks. They would like the mortuary and relevant departments to be built underground. Perhaps you should leave some time for the Secretary to answer your question. Right, thank you, Chairman, and thank you for the questions, Madam Wong. Now, you raised the needs, the healthcare needs of the babies born to mainland parents. The Department of Health and the HA are providing services to pregnant women and children under 5. This is for your information, but we also take on board your view. As for the traffic matter, perhaps I can defer to Mr. Lee.
Well, as I said, the consultant analyzed the data. The likelihood of the entire road being clogged up would be minimal. The Tin Tan Street entrance is a feasible and acceptable proposal. In the long run, the road would have implications on the entire hospital, but at the present moment we don't really want to get in the way of the schedule. There are 6 members. We have reached the limit of the time. I'm not talking about the traffic flow, I'm talking about the possibility of accidents. Well, the road is sufficiently wide, and it would be widened, in fact, the likelihood of the entire road being clogged up would be negligible. Ms. Alice Mack. Chairman, the FTU is in support of this project and would like to see this completed as soon as possible. We understand that the hospital authority is hamstrung by manpower shortage, in particular the NT-West cluster. And there is an exodus away from the cluster. We are concerned about the manpower. I mean, some of the disciplines will be running out of manpower. So in terms of manpower recruitment, what will the government do? Second, other than nurses and doctors, there are supporting staff, the armors and so on. Will there be any recruitment fair in the local district, and that will provide job opportunities for the locals? Third, in Tin Shui Wai, a community healthcare center has been opened. For general outpatient clinics, the services are not sufficient. The hospital will not be coming on stream until 2016. In paragraph 14, it says that improvement will be made if the need arises before the completion of the hospital. If the residents would like to have a particular kind of medical service, how would you increase that? And it is said that the hospital is needed because of aging population. We have a dearth of specialist care. I'm more concerned about orthopedics. I was checked into an orthopedic ward myself recently, and I had a bad problem. This hospital is needed because of the aging population, but orthopedics will not be provided. Why? Right. In the interest of time, Secretary, please. Chairman, in terms of manpower planning, the hospital authority has done an awful lot of work. I'm grateful to you for the question about the community care center and the specialist services. Perhaps I can defer to Dr. Zhao. Right, in terms of manpower, the hospital authority is indeed facing the shortfall of doctors and nurses, but in the coming years there will be room for improvement. In 2015 and 16, there would be more graduates who will be joining the service. In terms of care or nurses, we will have 2,000 per year trained up. There will be some improvement by 2016 and 17. So we are optimistic about manpower in regard to this hospital, we probably have to implement in phases depending on the manpower. Before the hospital is coming on stream, there will be plans to improve the services like in-hospital service. In 2016, there will be a couple of hundred more beds for Pok Hoi and Tuen Mun hospitals. For outpatient clinics, the community healthcare centers are not fully operational. We will deploy additional manpower to increase the services. Now, as for what discipline we need and how much we're going to increase that by, we keep an open mind. We will be planning for the kind of specialist services at the hospital. Supporting staff, they will be recruited at the same district. Is that correct? Well, other than doctors, nurses, and allied professionals, we need 700 staff members, and they will be recruited at the district primarily. Now, there is a sense of belonging if they're recruited locally, and the wastage rate will also be lower. Mr. Lee Chuk-yen, I feel obligated to support that because otherwise it will be delayed even further. The scale and also the location are not good enough. Tin Shui Wai is a vast area. I wonder why you picked this small area. Eventually, I must say, go on the record to say that I'm disappointed. 300 beds. What can you do with the 300 beds? The hospital authority mentioned flexibility in the light of opinions. Now you have 300 beds. What advice can we offer? We may collect views from the public. Now, how many specialist disciplines would there be? How many beds would there be? Maybe you have 3 or 5. Well, I can't have everything. I can't have orthopedics, pediatrics, medicine, all at the same time. You don't have obstetrics. You don't have orthopedics or pediatrics. I mean, you have all the beds for medicine and surgical discipline. We need to consult the public, but at the end of the day, you were to say that for 300 beds, you would devote them to medicine and surgery and nothing else. I wonder how many disciplines we can include for the 300 beds available. I heard that in 2021, the ratio will be 3.1 per 1,000. So we cannot quite achieve that in 2016. How soon? Can you achieve the target sooner? In NT West, I heard that there are 780 in NT West. There are 300 in Tin Shui Wai. Can you have 480 in Pok Hoi and Tuen Mun hospitals? Can you have them available sooner rather than later? Secretary. Right, thanks very much, Mr. Lee, for the question. During the planning stage, I realized that Dr. Zhang already mentioned that we will be looking at the demographic changes, and we will be consulting the public opinions and the district councils when determining the specialist disciplines. Dr. Zhang, Tuen Mun Pok Hoi, can they create 400 odd beds? They are available now. In Tuen Mun Hospital, they have a convalescence block, but some of the wards remain unopened. We are facing a manpower problem at the moment, and we do know that there is such a demand in NT West. Given the manpower shortage, we will open up creating all these 400 or so beds before 2016 to meet the demand, and then we'll bring about the Tin Shui Wai Hospital. How many specialists would be available for the 300 beds? Dr. Zhang, it would be difficult for us to say at the moment. Basically, there are two types, acute wards acute ward and also the convalescent ward. As to how many beds will there be for each discipline, or are we going to break them down into different disciplines? I think it is important for the patients to have the services they need. We can be flexible. We don't really have to have one discipline in one single ward. We can have a couple of specialist disciplines in one ward. It depends on whether we can have the orthopedic or the medicine specialists to look after the patients. We have to look at the bed instead of the number of specialists. Well, if that's the case, then we can have all the specialist disciplines in the hospital. Dr. Joseph Lee, well, this is for us to preview the proposal. There's no reason why we should object to that. The 300 beds, I mean, this is this can be used for all kinds of specialist disciplines. My question is very straightforward. There will be 300 beds in 2016. How many beds will be available for use in 2016? I can't see 300. All of them will be used. Now, will the beds be used for acute patients, or will they be broken down into different disciplines? Also, convalescence. Tin Mun has convalescence beds, but not so much in Pok Oi. In Tin Shui Wai Hospital, if they are for acute patients, what about convalescence beds? People need to have convalescence after acute stage. Third, you're going to have manpower shortage. You have to train up enough people within the coming 4 years, and there will be sufficient doctors and nurses, hopefully, by that time. My question is very straightforward. In terms of ratio between doctors and nurses, how many doctors or nurses would there be per bed? How can you assure us that there will be sufficient manpower for the hospital? How soon are you going to open up all the beds? I think the Western Corridor will be very busy. Now, this is not a general hospital. This is more like a community hospital. In the NT West, would that be a local hospital in the overall scheme of things? Secretary? Well, in your question, you touched on the cluster. Perhaps Dr. Lau can address the question. I think what you said is correct. The Tin Mun Hospital will be what we call the dragon, or the leading hospital. This will be covering the leading cases. Now, for Tin Shui Wai Hospital, we will not be opening up all the 300 beds all in one go. This will cover a horizon up to 2010. We'll open the A&E to start off with, and this is something anticipated by the residents for a long time. We also have some specialist disciplines, and for the rest of the services, that they will be provided in stages. Dr. Zhang has already mentioned that the ultimate arrangement will have to be put in place nearer the time, depending on the demand in the community as well as the services provided by the other hospitals in the cluster. You mentioned the convalescence beds. There is a convalescence block in Tin Mun Hospital. Most of the patients requiring convalescence will be referred to that particular block. In terms of planning, in the entire cluster, there is a lack of convalescence service. The patients will stay in hospital longer. For acute patients, they will stay for a couple of days, but for convalescence patients, they will stay for a couple of weeks. If they are closer to the community, it would be better because of better accessibility. So we do plan for certain convalescence beds, in particular for Tin Shui Wai residents, because that would be convenient for the residents living in Tin Shui Wai. How many doctors and how many nurses for the 300 beds? Make it simple, please. According to the existing mode of service, for other hospitals in the hospital authority, we anticipate that there will be a need for 70 doctors, 270 nurses, but that's a ballpark figure because that's in accordance with the mode of service provided by other hospitals.
Mr. Chen Hanpan. Thank you, Chairman. I'm also concerned with the number of medical staff members and doctors. Now, you mentioned there will be 300 beds there, and once the hospital is in commission, you will deploy officers to work in the hospital. Will that lead to shortage in manpower in Tuen Mun and Pok Koi hospitals, especially in the number of experienced medical officers? Now, I'm worried about the quality of services in these two hospitals, if that's the case. Will you deploy staff from the same cluster to the new hospital or from other clusters? Now, Dr. Chen has given you a preliminary idea about the deployment. I think he can supplement. We will not opt for open recruitment, but most of the staff will be from NT West. Now, of course, when officers are deployed to the new hospital, there will be other staff members being deployed to the cluster. Now, you, of course, understand that we cannot rely on medical officers with no experience to work in the new hospital. So we do need experienced medical staff. And there is still some time before the new hospital is open. We will step up our training and our plans to return the staff. Now, at present, there is a shortage in manpower in Changchun Hospital. I don't want this to repeat itself. People have expectation for Tin Shui Wai Hospital, but if you see a shortfall in manpower, Changchun Hospital, are you saying there is a hospital in Changchun? I mean, the one in Lantau, that is, I consider that as Changchun. So, at the beginning of next year, I hope the local residents will not be disappointed. And please remember your undertaking that you will step up training and in introduction of more doctors. I hope you can also step up your effort on the front. Mr. Albert Chan, several points to make. We have been fighting for this hospital for many years. I've been having numerous meetings to fight for the construction of this hospital, and in the end, the government undertook to build this hospital. But I'm not satisfied with the location you chose. This is a rather small plot of land, so for extension, it will be rather difficult. So I hope you will reserve the piece of land of FEHD for future extension. Now, I don't think the FEHD will encounter difficulties in relocating the depot, and they do not necessarily have to have the facilities there. That's why I think the piece of land can be reserved for future extension and relocate the FEHD facilities to other places, because they do not have to take up this precious piece of land. Now, I'm not so worried about traffic congestion, but then I don't quite understand how the mind of engineers work. You have roads for ambulances and private cars. But the pedestrians, if they want to go to the Blue Point, they have to go past the ingress and egress for ambulance. It's dangerous for them. In many housing estates, you have the same problem. You have the pedestrian crossing right in front of the car parks. So it's very dangerous for the pedestrians. I hope that's why you will relocate the entrance, because having it the way it is very dangerous for the pedestrians. My third point is about the design of service provision. Now, for many patients who are seeing specialists, they may have to go to General Hospital or other hospitals in the area. Can you make it possible for these patients to come to this particular new hospital for follow-up appointment, for example, those suffered from stroke, etc.? Now, you have over 300,000 people living in Tin Shui Wai. You cannot cram all the specialists in Tin Shui Wai, but can you allow patients from other districts to come to this hospital for their follow-up treatment or appointment? Thank you, Mr. Chen, for your comments. For the location, yes, FEHD facilities is a good point. It's also under the same bureau as us, so we'll ask them to give it some thought. As for the ingress and the egress, perhaps Mr. Lee can take up the question. Yes, can you leave more space, road space for the pedestrians? Now, this is just the preliminary plan, and when we come to the actual building of the hospital, we can certainly take on board your view. As for the specialist services, I agree with Mr. Chen. We have to take care of the needs of the local residents in Tin Shui Wai. They can go to the specialists in the Tin Shui Wai Hospital. This is our plan. Next, Dr. Chang. I know we have a time constraint. I will not ask lots of questions, but I would like to come back to a point raised by many members. That is the number of beds. On average, in Hong Kong, 2.9 beds per 1,000 population, and we see a lower rate in NT West, just 2 beds per 1,000 population. And even a lower rate in Tin Shui Wai. Every 1,000 person, you don't even have 1 bed for these people. We have over 280,000 people living in the area in 2011. But by the time the hospital opens, it will not be the same number. For example, let's put it down to 290,000 people. Let's use the same bed patient rate. That is 2.9. That means you have to provide 800, 900 beds by that time. Okay, now maybe you say you want an average number. That will still amount to 600 beds. You know, we have a mobile population in Tin Shui Wai. They may not necessarily stay and live there for a long time. So I think you have to take care of the height restriction. We're not talking about a large site, but over 13,000 square meter. So maybe you can build a taller building. We know Tin Shui Wai is the youngest community in Hong Kong. So you see lots of young women living there. Maybe it's because they are married to local men. That's why you have lots of pregnant women. Most of them are pushing a pram. Maybe you should allow some time for the secretary to answer your question. Now, my question is, can you provide obstetric and gynecology services in the hospital as well? Thank you, Chairman. About the number of beds, Dr. Chang has given you the rough number. 300 beds will be added to Tin Shui Wai Hospital, and NT West cluster beds will be opened up. So by that time, we're talking about a rate of 3.1. Maybe Dr. Cheng can supplement further on this point later. Just now you mentioned there is a large service need for young women and children. Of course, we are concerned about that as well. We will see if we can provide services to this particular group. Dr. Cheng, supplement as to whether we should provide services to pediatric and obstetric services. We'll take that on board to see whether we can provide that. And we will also see whether there is room for extension in the future in the neighborhood. Of course, we want to build a bigger hospital. Still, we are constrained in terms of area. So inevitably, we have to build a tall building up to over 10 stories. And we have to optimize the use of space. Taking into account the beds in Tuen Mun and Pok Hoi hospitals, we are of the view that we will be providing sufficient beds for NT West cluster. We still have 2 items on the agenda, and we don't have sufficient time for the discussion, so I now announce meeting will be extended for 15 minutes. Dr. Cheng, Mr. Cheng, just now you say you will need 70 doctors. Every 1,000 persons, they will be taken care of 0.23 doctors. Now, the average rate across the territory is 0.7. So the patient-doctor rate is rather low. And you're saying that the bed-patient rate can be raised to 3.1, but then every 1,000 persons, there should be 5.5 beds for these people. This is your target, and you see there is a difference between the reality and your target. Now, when do you think you can achieve the target of 5.5 beds? Anyone can answer this question? Now, in terms of doctor-patient ratio and bed-patient ratio, I think Dr. Cheng can give you the details. Of course, we have to take into account the number of doctors in Tuen Mun and Pok Hoi hospitals. You cannot simply look at the number of doctors working in Tin Shui Wai Hospital in looking at how many doctors will be serving Tin Shui Wai residents. Now, this hospital is not one serving people in Tin Shui Wai alone. The new hospital is there to work with Tuen Mun and Pok Hoi hospitals as well. As for the ratio you mentioned, is rather outdated. We have to look at the mode of operation of the whole healthcare sector. Now, patients do not have to be hospitalized for a long time because they can be taken care of by outpatient services. So who can answer the question? Dr. Low. Bed to population ratio provided by the planning department in fact covers beds for acutely ill, for the mentally ill patients. It also covers correctional services, beds, and beds in nursing homes. The definition comes from Hong Kong laws. Perhaps you can answer me in this way. Dr. Cheng said we have to take into account the beds in Tuen Mun and Pok Hoi hospitals. So for the entire NT West, what's the patient-doctor ratio? How far are we from the 5.5 target? Can you give us the details? Yes, please supply us with the details because we're talking about planning for the entire territory. So may I ask members shall we support the proposed construction of Tin Shui Wai Hospital? Yes. All right. The panel supports the funding application of the construction of this hospital. Now we still have two remaining items. Proposal to set up subcommittees. First, before the last term ended, it was proposed that we should set up the subcommittee to follow up on the health protection scheme. Terms of reference and proposed work plan have already been tabled to members. So shall we set up the subcommittee? Anyone against it? And in our support, do you wish to say anything in particular to the terms of reference and the work plan? Now for the terms of reference, we mainly made reference with those proposed in the last term, that is to look at the land provision, the financial side, and other relevant factors in relation to the progress of HPS. The subcommittees will be submitting analysis and reports in 2013-14.
Dr. Fernando Zhang, Chairman. My understanding is that we should have some restriction on the number of subcommittees. Of course, we'd like to see this created. I would be keen, or more keen, to have the joint subcommittee between the Health Services Panel and the Welfare Services Panel. We are prioritizing the subcommittees depending on the urgency. Now we filled the quota. I gather that there are only 8, and we couldn't wait our turn. I think we're trying to hurry up and get this created as long as we have the quota unfilled. It's all a matter of quota. Like you said, we do have a quota restriction. Chairman, if you see the urgency, of course, we'd like to see this created, but also would like to have the joint subcommittee formed on long-term care policy. Mr. Chen, I would support that because this is a big thing for Hong Kong as well as for the insurance sector. I support this. Well, thank you very much. The Secretariat will be inviting whoever is interested to join, and we'll have to submit a proposal to the House. Oh, we don't have to. We can just get this up and running as we wish. All right. The second proposal is by Dr. Fernando Zhang for setting up a joint subcommittee on long-term care policy under the Health Services Panel and the Welfare Services Panel. The Welfare Services Panel subscribed to this idea at its previous meeting, and now we are consulting members on their views. Mr. Fernando Zhang's proposed terms of reference, the scheduled and so on have been circulated to members. Dr. Kwok, Chairman, I go along with that because this is an urgent but pressing issue. Ms. Helena Wong, I support the idea, Chairman. Well, with member support, In terms of the TOR, the terms of reference, any comments, if I may, Chairman? Basically, we are targeting the community care and institutional care, the disabled, the senior citizens, and the chronically ill in terms of long-term care for them. All right, and the Secretariat will be inviting members to join the subcommittee. Any other business? I gather that members support the proposal. With the support of the panel, do we have to take them to the House? No, we don't have to, because we haven't quite filled the quota of 8. So that's why we try to beat other people to it. All right, if we are quick enough, we can have the 2 set up. Any other business? Tomorrow there's going to be a special meeting to be held with the FEP on the question on the issue of infant formula. This is going to be a public hearing, and on the 27th of this month at 2:30 we'll be hearing deputations on medical beauty treatment. So please join as much as you can. Without any other business, I adjourn the meeting. Thank you all very much.